Hi everyone, welcome back to Forward Therapy. Today we are going over CHT test prep questions for this month. So I thought that this would be a really fun new series on the YouTube channel for anybody that is wanting to be a CHT, or if you want to test your knowledge and see what you remember, or if you are a new hand therapist and you just want some practice questions thrown at you. This is going to be a really fun thing. We're going to do one of these videos a month. There will be 15 questions. I am going to read all of the questions to you. You can pause the video as much as you need to take time, write down your answer. Then we'll go through a hint for each of the questions again. So we'll go through the questions again and give you a little hint for each one. Make sure that you have your answers ready and written down, I would suggest. And then the last part of the video, we will actually go through the answers to these questions. So grab a piece of paper, grab an iPad, grab your computer, whatever you need, and get ready to test your knowledge and do the CHT test prep with me. If you guys like this video, give it a thumbs up. Comment below if you'd like to see more of these types of videos, and let's go ahead and get into it. A new patient comes to your clinic complaining of hand pain and stiffness of the fingers. He complains of morning stiffness, which resolves throughout the day, aching joints, and difficulty with opening jars and fastening buttons on his work shirts. He is concerned about the increase in size of his DIP joints as of late, which is a hallmark sign of osteoarthritis called... What clinical sign would be documented in a patient with ulnar nerve palsy who is unable to radially and ulnarly deviate their middle finger? When approved to perform early protected motion after lateral elbow collateral ligament repair, what position should elbow AROM exercises be performed in? A patient presents to the clinic status post slap repair at week 2. What directions of shoulder ROM should be limited for the first 4 to 6 weeks? A patient is able to detect dynamic 2-point discrimination at 5 millimeters. How is this result interpreted? Upon assessing a patient with a diagnosis of carpal tunnel syndrome, the patient complains of paresthesias in the thenar eminence. Which nerve supplies this area? What are trophic changes that can occur due to peripheral nerve injury? What soft tissue structure would most likely be disrupted during a PIP fracture with a dorsal dislocation? A fracture at the metacarpal neck of the 5th digit is known as a what fracture? Your assessment reveals that a patient with elbow pain has the following symptoms: pain with resisted supination while the elbow is extended, weakness of the finger and thumb extensor muscles, no paresthesias or sensory disturbances are reported. The resisted wrist extension and radial deviation is normal compared to the contralateral wrist. What diagnosis is most likely? After surgical intervention for posterolateral rotary instability, when would be the earliest appropriate time to introduce a static extension orthosis for night use if the patient is not making expected gains? When should early active motion begin for a patient with a type 1 non-displaced radial head fracture? Which of the phases of tissue repair contain mast cells, which release histamine, neutrophils, and macrophages? A patient with arterial compromise would likely present with blank color and a blank speed of capillary refill. A hand therapist is assessing a new patient's passive range of motion. After removing their hands, The therapist notes that fingertip pressure leaves a depression in the patient's skin. What type of edema does this describe? Okay, guys, part 2 here. I'm going to give you some hints so that you can try to get the answers to all of the questions. Make sure that you pause the video as needed to think about your question, or think about your answer and think about the question, and then we'll go through the answers. Okay, so your hint for this first question is to really think about the hallmark sign of osteoarthritis. So think back to all of those common deformities that we would expect to see or that are very common with osteoarthritis rather than rheumatoid arthritis. The hint that I would give for this question is think about the different ulnar nerve palsy motor signs, and particularly thinking about pad and dab, or the palmar adductors versus dorsal abductors, abductors. So the hint for this exercise is to think about the structure. Think about the lateral elbow collateral ligaments, and think about what you are protecting with this type of repair. So think about the position that you think the forearm should be in. In this question, I want you to think about 2 specific shoulder types of range of motion that you should be limiting with a slap repair. So there are 2 that I'm looking for. My hint to you here is think about those ranges of normal, poor, fair, or non-functional. Think cutaneous branches of nerves. Your hint here is that trophic means skin. So think about skin. The structure that we are talking about here restrains hyperextension at the PIP joint. Ooh, for this one, think Rocky Balboa. This right here is a differential diagnosis question. So with this, I would really be thinking about the symptoms listed and maybe thinking about where potentially a nerve might divide, and sensory versus motor, all that good kind of stuff. The hint here, I would think about what is posterolateral rotary instability. Think about the structures that maybe you are protecting. Yeah, that's the best I can do for this one. I don't have a great hint here. Think about the elbow anatomy. So the bony congruence, the ligaments, other factors that maybe make the elbow stiff very quickly. And then think early. The hint here is histamine. So think about histamine and maybe what that specifically triggers. When you think of arterial compromise, that means that the arteries are not working, the veins are working. So think about that and figure out what color would it turn based on that. When I think about this type of edema, I think about fruit, like a peach or like an avocado. And there's sort of this impression inside of the fruit, which is left by the, for lack of a better word, the seed inside of the avocado, which is also known as the blank. Okay, guys, we are going to go over the answers now. So If you have not gone through all of the questions and you haven't found your answers yet, please go ahead and pause the video until you do, and then you can come back here and go through the answers. A new patient comes to your clinic complaining of hand pain, stiffness of the fingers. He's talking about morning stiffness that resolves throughout the day, aching joints, difficulty with some ADLs like opening jars. He's concerned about the increase in the size of his DIP joints as of late, which is a hallmark sign of osteoarthritis called Herbert's nodes. Something to remember. Herbert's nodes typically will show up first, not always. Sometimes people will have the Bouchard's nodes at the PIP first, but Herbert's is a good thing to look out for signs of osteoarthritis. What clinical sign is documented for a patient with ulnar nerve palsy who's unable to radially and ulnarly deviate their middle finger? That is the Igawa sign. When approved to perform early protected motion after lateral collateral ligament repair, what position should the elbow active range of motion exercises be performed in? So first of all, we want to probably limit extension initially, oftentimes to 30 degrees, but you have to check with your surgeon. And neutral to pronated forearm position is going to be the safest to protect that lateral collateral ligament repair. With a slap repair, especially if they're, very early out, you want to avoid abduction at 90 for usually the first 4 to 6 weeks. And you also want to avoid external rotation and be very cautious with that as well. Patient is able to detect dynamic 2-point discrimination at 5 millimeters. This result would be interpreted fair. So this patient has a diagnosis of carpal tunnel syndrome, but they are complaining of paresthesias in their thenar eminence. The nerve that supplies the thenar eminence is the palmar cutaneous nerve. So trophic changes that can occur with peripheral nerve injury. You're thinking skin, so that would be probably skin texture, maybe some atrophy of the fingertips, changes in the nail beds, hair growth, slower skin healing, just to name a few. The soft tissue structure that would most likely be disrupted during a PIP fracture with a dorsal dislocation is going to be the volar plate. A fracture at the metacarpal neck of the 5th digit is known as, of course, a boxer's fracture. The diagnosis that is most likely with the symptoms listed here and with those provocative maneuvers or tests, the clinical testing, is a PIN syndrome, posterior interosseous nerve. After surgical intervention for posterolateral rotary instability, when would be typically the earliest appropriate time to introduce a static extension orthosis for night use if the patient is not making their expected gains? Typically, this is after 4 weeks, although you would definitely want to verify that this is appropriate with the surgeon. When should we be starting early active motion with patients that have a type 1 non-displaced radial head fracture? We want to begin within 1 week, if at all possible, to avoid stiffness because of the elbow anatomy with that congruence, the ligaments that are so stable, inflammation, and our position of comfort, which is typically in a flexed position of the elbow. So people will get stiff super fast. What phase of tissue repair contains mast cells? So the hints here were kind of that they release histamine, neutrophils, and macrophages. This is indicative of the inflammatory phase of tissue repair. A patient with arterial compromise would likely present with dusky color and a slow capillary refill. The hand therapist assessing a new patient's passive range of motion, they remove their hands from the patient and note that the fingertip leaves a depression in the patient's skin. So what type of edema does this describe? This is, of course, pitting edema. All right, everybody, that is going to do it for today's video. Thank you so much for watching and participating. I hope you enjoyed that. If you did, please go ahead and give this video a thumbs up. If you'd like to see more of this on the channel, please comment below with whatever types of videos you want to see this year. And please subscribe to the channel so you never miss another hand therapy video again. And let's do it. Let's get everybody qualified and ready to take their CHT exam this year. You guys are amazing. I believe in you. Don't give up and keep on studying. Thanks for watching.